Greetings, Graham Warren working with you on an AnyLogic model for the hip hop case. So at first glance, this canvas of AnyLogic is just super busy. Very little real estate left to do pretty much anything. Let's see if we can unpack this. So we have two ORs in each track, and each track is represented, track A is represented here, and track B is represented down there, and they're identical. Let's go through one of these tracks to just see what's entailed. So patients are arriving here, and the way this is set up is they're going to arrive every 90 minutes, and that time is going to be normally distributed. Okay, so there's the inter-arrival time mean, and has a standard deviation of 5. So one thing to note here is that there's just a ton of parameters that we can play with to consider various scenarios, and the functionalities of this workflow are captured by these processes. So things like the inter-arrival times, the registration times, the sedation times. We may not be changing any of these, but they certainly are all parameterized here in case you do want to adjust them. Right. So in the base case, I believe the inter-arrival time is 90 minutes, but we're capturing that with a parameter and 5. Now, one thing to notice here is that this thing is actually not a normal distribution. It's a truncated normal distribution. So just as a reminder, what we're doing here is we have a normal distribution with a mean of 90 in the base case and a standard deviation of 5 minutes. And then we're chopping off any negative values because we can't have inter-arrival times that are negative. So it's a truncated normal distribution. In this particular case, 0 is very far from 90 in terms of the number of standard deviations. So, it's 18 standard deviations below the mean. So it is just very few, instances where we are going to get a negative negative inter-arrival time. So for all intents and purposes, consider this as roughly normal. But if the standard deviation was larger or the mean time was closer to 0, then this would have a biasing effect on the inter-arrival times. Okay, so at the model start, we get an arrival, and then they arrive every 90 minutes after that, up to a maximum of 6. Now, it's conceivable that if you make some really wonderful changes, that you may need to come back in and increase this from 6 to 7. But for now, the thing is set up to, if we can get 6 surgeries, we're happy. More, of course, is not going to be frowned at by hospital administrators. All right, so patients arrive. We start a timer on them. Now, we want to time them from the time that they arrive to the time that their surgery is complete. And we're not going to factor their recovery time. We're really not interested in, what happens during recovery, from the perspective of the simulation, at least. Or whether they go home that day or they stay in the hospital. We're just measuring time of arrival to completion of surgery. So that's the timer, and I've got a timer in each track here. Then we go ahead and we grab a registrar. Now there's different pools of resources here, and there's a registrar pool that is serving both track A and B. The EVS pool of folks who prepare the ORs for the next patient are also pooled in the base case. The anesthesiologists, surgeons, and ORs are not pooled in the base case. There are 2 ORs, 1 surgeon, and 1 anesthesiologist in each of these tracks, and they're not pooled. Pooling the anesthesiologists and the ORs is going to be something that we will consider as one of our process innovations. Okay, but just go back to to our initial discussion here. The patient comes in, click the timer, we register them. Now this registration time is normal with a mean of the registration time mean, that's this number here, and the standard deviation that's provided. So you can change those if you want. I don't remember what they are in the base case. They're not very long. But those are parameterized. Now, from there, the patient grabs an OR, grabs an anesthesiologist and goes through the sedation process. The sedation process has a duration that is specified by the sedate time mean and the sedate time standard deviation. Again, it's truncated normal so that we don't get negative times. So once they're sedated, then they go through surgery. And the surgery is actually where they get a surgeon. So the surgeon is grabbed here. Now that surgeon is somebody they've consulted with, right? There's only one surgeon in the track. After the surgery is done, the anesthesiologist is released, the timer is stopped, and so the surgeon is actually released directly after the surgery. The surgeon is only present here during this while this block is operating. Then we release the surgeon, that's instantaneous. Stop the timer. We then grab one of the EVS pool folks to clean the OR, and then we release the OR and the EVS person, and then the patient, is disposed of. So that's the workflow, and it's identical for both. The statistics that are being collected here are kind of interesting. There are some long-run statistics in the form of utilizations of the anesthesiology pros, the surgeons, the ORs, the cleaning pool, the EVS pool, in other words, and the registrars. That's also a pool. We're getting the histograms of the patient flow times here. And I want to just show you something that's interesting here. So you can figure out how much data to collect here. Just to see if I can figure this out. Yeah, we want to update automatically, I guess. So let's just change that. And so we'll get those dates, those completion dates, also the mean flow time. So they're only going to be 4, 5, or 6 surgery completions in a day. So this histogram is going to be pretty toothy. This one also, right? They're roughly the same, these two tracks. I want to talk you through the time evolutions here. I'm showing you the time evolution of the utilization time evolution for the anesthesiology pros A, which is this group here, that resource pool, the surgeons in pool A, and then the operating room in pool A. And I could have done that for track B, there's just no space. And these two tracks are, for all intents and purposes, roughly equivalent. Different patients are going to go through there. The surgery times are normally distributed with a mean of about 100 in the base case, and standard deviation of, again, maybe 8 minutes or so. Those are, again, parameterizations that you can change here. So there's the mean surgery time in A, and it's standard deviation, and then we can have a different surgery time in B, and a different standard deviation also there. Okay. So the reason I've got these in is so we can see what's actually going on in the system. And when we run the model in the next clip, that is going to be clear. There's also an animation here, which I see that I have to got an extra little arrow there. That's fine. Basically, this is going to just track in each of these two OR tracks where the patient and the different agents are. So I hope that's enough. We may have to come back and consider just a few things. One other thing to note is that in the base case, we have 600 a day that is 600 minutes long. These free versions of the software are cut off at 50,000 agents. That's just not going to be important here because we're only going to have 6 patients flying through the system. But what we want to do is we want to end this experiment. So the model time, we will stop at a specified time, that's 600 minutes. I think we may have to do that here also. I've got that in the optimization experiment. I just want to see in the run configuration, I specified that as well. So I don't know which one is the ruling configuration. I think this may be the run configuration. But I want to stop these simulations at 5 minutes. And in the simulation main, I want to make sure that we have a random seed that we're going to be using. So I'll just save that, look at the configuration main, excuse me, the optimization main, also make sure that I have a random seed. So that is in fact in place. We'll talk about the optimization sort of as the final clip. So the idea behind this random seed is I'm going to need to observe these 4 ORs in operation on multiple days. The various distributions are powered by random number generators, and these random number generators are essentially sequences of random numbers, but they need a starting point. And if you vary the starting point randomly, you get essentially what looks like a different day, a different time evolution of the OR suites for a different day. So I want to, suggest that you replicate these runs, these analyses 3 to 5 times so that you're reporting averages rather than means. And if you do see a lot of variation, maybe report a confidence interval for those 3 runs. Okay, so that in a nutshell is our model. And we'll come back in the next clip, run it and just explore the base case.